A recent study unveiled that people who compensate for their weekday sleep deprivation by clocking in extra hours of rest during the weekends may experience a reduced risk of coronary heart disease by up to 20%. This encouraging news was presented at the European Society of Cardiology conference on August 29, 2024, held in London, United Kingdom, and the findings were reported by Science Daily. Sometimes a week jam-packed with work or exams demands reduced sleep hours or altered sleep schedules, leading to sleep deprivation. It's widely known that those suffering from sleep deprivation tend to sleep additional hours on holidays to mitigate the effects of sleep loss. Researchers leveraged data from 90,903 participants involved in the UK Biobank project, a broad medical and research database resource that allows for groundbreaking scientific discoveries aimed at enhancing public health while maintaining patient privacy. To evaluate the relationship between compensatory sleep on weekends and heart disease, sleep data was recorded and categorized into 4 approximate groups from least to most compensatory sleep. Researchers identified individuals who reported less than 7 hours of sleep per night as experiencing sleep deprivation. A total of 19,816 participants, 21.8%, were identified as sleep deprived. The remaining participants occasionally suffered from sleep loss, but their average daily sleep hours did not meet the criteria for sleep deprivation. Hospital records and mortality registry information were used to diagnose various heart diseases, including ischemic heart disease, heart failure, atrial fibrillation, and stroke. Over an average follow-up of nearly 14 years, participants in the group that received the most compensatory sleep were 19% less likely to develop heart disease compared to those who received the least compensatory sleep. The analyses revealed no differences between men and women. Zek and Liu, co-author of the study from the State Key Laboratory of Infectious Disease at Fuwai Hospital and the National Center for Cardiovascular Diseases in Beijing, remarked, "Our findings indicate that for a substantial portion of the modern society population grappling with sleep deprivation, those who receive the most compensatory sleep on weekends exhibit significantly lower rates of heart disease compared to those who get the least compensatory sleep." Dr. Shigeki Hinohara, a renowned Japanese physician who lived to the age of 105, offered valuable tips for living a long and healthy life. He was a pioneer in preventive medicine and authored 75 books on physical and mental health. In his best-selling book, published posthumously, he revealed the secrets that allowed him to remain healthy and active until his passing. Here are 12 tips from Drive Hinohara. 1. Watch your weight. Being overweight or obese impedes well-being and lowers life expectancy. Maintain a healthy lifestyle and consume nutritious foods. 2. Take the stairs. To improve physical fitness, avoid elevators and opt for stairs. This simple change increases daily calorie expenditure. 3. Eat healthy foods. Even if you prefer processed foods, strive to break this habit. Consume foods that nourish your body, rich in vitamins and minerals essential for energy. 4. Engage in relaxing activities to forget pain. Pain can sometimes be mysterious. Practice meditation, listen to soothing music, or engage in activities you enjoy to alleviate pain. 5. Let go of troubling emotions. Emotional distress can manifest as physical pain. These psychosomatic disorders reflect your inner turmoil. Identify and eliminate negative emotions. 6. Stop worrying about tomorrow. Life is a series of unpredictable events. People often worry about the future, but since you have no control over it, focus on adding happiness, beauty, and love to your present. 7. Keep your thoughts positive. Feeding your mind with positive thoughts energizes your body and helps achieve meaningful goals. Fill your spirit with joy, love, and gratitude to be happy. 8. Stay active as long as you're healthy. There's no set age to stop working. If you feel successful and love what you do, don't retire merely because of age. 9. Plan your daily schedule. Organize your tasks and set concrete goals to become more productive. 10. Resist the urge for more money. Most people are never satisfied with their wealth and always want more. This constant pursuit prevents happiness. Learn to appreciate what life offers and be grateful. 11. Have a source of inspiration. Feel unique and inspired by those who guide you towards the right path. Recognize your individuality while learning from the successful around you. Memory loss is a frustrating phenomenon that can occur at any time, whether it be forgetting where you placed your keys or struggling to recall your favorite recipe. It's important to note that memory loss is not always a sign of a serious health problem. In fact, several health conditions can cause memory issues, ranging from depression to Alzheimer's disease to diabetes. In a report published by the French site Presse Santé, François Lin outlines the main causes of memory loss to better understand and manage this issue. Depression and anxiety. Depression and anxiety are mental states that can directly impact memory. People suffering from depression or anxiety often face difficulties in recalling specific memories or events. Some studies have linked chronic stress and brain inflammation, which can harm memory. Additionally, depression has been associated with an increased risk of dementia, as both conditions can lead to the shrinking of gray matter in the brain responsible for memory and emotions. Thyroid disorders. Whether the thyroid is underactive, hypothyroidism, or overactive, hyperthyroidism, thyroid disorders can cause cognitive symptoms, including memory loss and brain fog. This butterfly-shaped gland primarily secretes hormones that regulate the functions of our organs, including the brain. Fortunately, these conditions can be easily treated with thyroid medication. Diabetes. Maintaining stable blood sugar, glucose, levels is crucial for diabetes patients. Since glucose is the body's main energy source, an imbalance can affect our ability to function normally. Over time, high blood sugar levels can damage the brain, while low levels can cause confusion. Moreover, diabetes can harm blood vessels, increasing the risk of heart disease and stroke, which can adversely affect blood flow to the brain and thus memory. COVID-19. While most people recover from COVID-19 without issues, about 20 to 30% experience long COVID symptoms weeks after infection, including memory problems, especially in storing and retrieving new memories. Researchers are trying to determine who is more susceptible to cognitive disturbances post-COVID-19, which some believe result from brain inflammation. Lyme disease. This disease is typically transmitted to humans by ticks. When an infected tick bites you, it can transfer bacteria into your bloodstream over a few days. This disease causes inflammation throughout the body, including the nervous system, with a rash often forming at the bite site. Without prompt treatment, symptoms can worsen to include memory loss and mood changes, among other issues. Fortunately, antibiotics can help treat this condition. Alzheimer's disease and dementia. Dementia is a brain disorder that can impact memory and other cognitive functions, with Alzheimer's being one of the most well-known types. Dementia causes brain cell damage leading to memory loss, which usually begins mildly and progressively worsens. While some medications can help manage symptoms for a time, it's crucial to consult a doctor as soon as dementia is suspected to create a personalized plan to delay the worsening of memory loss and other symptoms as much as possible. Medications that can cause memory loss. Unfortunately, some medications can have side effects, like memory loss. These include antidepressants, antihistamines, anti-nausea drugs, bladder relaxants, blood pressure medications, statins, steroids, and sedatives.